Welcome back to Inside. I'm here with Aging and In-Home Services of Northeast Indiana. We are talking about being your own healthcare advocate. So very important. So tell me some more about this topic.
Well, it was started in 2012 when we had an RN on staff. She was an out-of-towner, so her sister and her mom lived in Iowa. So every time they would take the mom to the doctor, the sister and the mom would both blow up Chris's phone and say, what does this mean? What does this mean? And the mom was 75 years old, multiple health conditions, and had no health literacy background at all, didn't understand it, and obviously the sister didn't either. And so she finally said, I can't do this, okay, all the time for them, but at least they have me to call. Because there's always one person that the whole family calls, okay? They're in charge of everyone's health literacy. And so she created this program, and we've been giving it ever since, that Be Your Own Healthcare Advocate begins with health literacy.
So let's talk about that term. What is health literacy?
So according to the U.S. Department for Health and Human Services, health literacy is the degree to which an individual has the ability to understand, communicate, process, and understand information so that they can better communicate regarding their health care. And so I know that's a big long term, and with it being Health Literacy Month in October, they kind of break it down with their slogan, which is finding the right words for better health. And it's just so important for people to be able to understand, because that ends up being better health outcomes, effectiveness, et cetera, for a long term.
You can't do anything unless you understand what you've been told to do. And excuse me, that they use in Healthcare Literacy Month, they say use living room language. So don't try to give it all the terms, try to take it down to as if you and I were sitting in our living room, what would we talk? And the folks who created this month, or Healthcare Literacy Month, said that the average physician writes orders and instructions at a 10th grade level. The average American reads at a 7th and 8th grade level, and 20% of the population read at a 5th grade level. So you can see right away, health literacy is a huge problem, and if we could read other language, we'd find that these same articles are appearing. This is a worldwide problem.
It makes a lot of sense. That's so very important that we understand what's being said. So why is this important to us? Why is health literacy important?
Well, the entire healthcare system is based on the assumption that you and I can process and understand complex verbal and written instructions. That's a bad assumption.
It's a bad assumption to base the entire system on, too.
Oh, totally.
Yes, so true.
That there's a statistic that 80% of what the doctor tells you, you forget immediately before you walk out the door, which leaves you 20% of what you've been told to do. And of that 20%, there's another statistic that says you have 50% of that wrong. So really, you go on a healthcare visit, whether it's the hospital or your primary care physician or emergency room, you have 10% retained of what you were told to do, which is the reason you can't take your medications, you can't do the regime that you have been instructed to do, because you don't know what you've been told to do.
That's a problem.
And that certainly, if English isn't your first language, then you can add another layer onto that.
Just exasperates it. So it's important not only to the entire healthcare system, but it's important to all of us. I mean, it's important to the person whose healthcare it is. It's important to their loved ones. It's important to...
It's the national economy, obviously.
Oh my gosh, yes.
That if you are hospitalized twice, okay, you went to the hospital, you had something fixed, you could not understand the instructions you have, you are going to be readmitted. And there's another statistic that says somewhere between 6 and 12% of all older adult admissions to the hospital can be related to medication episodes.
It's a huge problem. So let's talk about how we become our own healthcare advocates. We're going to do that when we come back. Stick with us.